No, it is not your speaker broken. This is what they experience every time they visit medical services. And no, these are not just memes. These are faces that react to them every time they try to communicate. Do you know that there are 5% of the global population facing hearing problems? Yes, 360 millions of people experiences those uncomforts when they communicate. Furthermore, in 2025, it is predicted that there will be 900 million people who will facing hearing problems. Nevertheless, this is the recent situation in the health service setting for the deaf people, and this is the most ideal. Recent international studies shows high number of deaf people feel unsatisfied with their health service, and it may be fatal in emergency setting. Thus, we proudly introduce UnDeafstand to help doctors understand what the people are really felt and help those with hearing loss understand what their doctor said. When you log in, you'll be directly welcomed by medical record system. Just add one new medical record. UnDeafstand will not just help you to understand, but also talk to the patient.
So getting to the back end, we can take the hand gestures from the deaf people as our data, or we can take the voice messages from the people who can speak, the mute people. We can take their voice messages as our data, and then we can feed the data to our AI model, which will then extract the useful information from the data we have just received and then fill it to the forms. So this all will help doctors to analyze their report better and save a lot of time as well. And maybe in the future we can use some APIs that can use the data we just gathered and recommend them some treatment which will help them a lot. And then getting to the AI model, we as we have the data in the form of hand gestures or the voice messages, we can feed it to the model, which we will create using TensorFlow or MediaPipe, and that model can also be used by the doctors to convert their text or their voices to hand gestures, or how deaf people communicate. So this will reduce the language barrier between the doctor and the patient. So when we are done with training the model, we can use that model for extracting the information from the real-time data and then feed it to the forms and then update it in our database. And this will just make it easier for the doctors to analyze and then make further advice to the patients. Then in the future we can add some APIs that can recommend some basic treatments on the old data, like some medicines for basic fever or something like that. So that's basically it.